your third trimester and you're looking for ways to labor prepare your body for a smoother birth experience. First thing, you're gonna need like a small step, whether it's a staircase, a small step stool, just something to prop your foot up. You're gonna put your foot on, okay? I call this one a no name, I know, I just literally have no name. So if you have a better idea and you wanna tell me, put it in the comments or send me a message and tell me what this should be called. So 1 foot on top, and you're just gently having those hips nice and straight through here. You're gonna feel a stretch through this hip. You're gonna tilt your hips forward and backward. Forward, backward. You're gonna do 5, going forward and backward. It's not much movement. You can see that you're not getting a lot of movement here. Okay, last one, and then you're gonna go sideways, and it's almost like you're you know, that 5-year-old girl who's shaking her hips, doing her little dance, okay? 5 going to the side, so one more. You, again, should kind of feel a little bit of a stretch in that leg on the side, but you may not. Lastly, you're gonna bring that arm up and over to the side, and this is like that, oh, that feels so good. And that relief, you're gonna hold for like, I don't know, 15, 30 seconds and see if you're gonna feel a difference on the other side. So you'll do the other side in just a minute, but just breathing in and out, nice and easy. Okay, last time to breathe in and out. And then you're gonna switch and do the other side. Now you're gonna switch to the other side. If you have a ball, like a big ball you can sit on, make sure you have that for this here, okay? So first, tilting your hips forward and backward. So you're just tilting like hips under and out, under, okay? Just 5, so one more after this. Good. And then side to side, up and down, up and down. Nice and easy. And then you're bringing that top arm over and reaching to the side. Breathing in and out. So you're getting a stretch through those like hip flexors, through the kind of a little bit of that round ligament, all the things that are helping to support your baby. So that way when the baby's ready to drop, they'll have an easier time dropping and putting pressure on your cervix so you can go into labor a little more naturally. You can have a smoother birth experience. If you're wanting help with labor and birth, besides just labor preparation movement, because these are just a few that I'm showing you, you want to know how to push, when to push, what movement you can utilize during labor and birth, you need to grab Pelvic Power Labor Done Right, or hop into some labor coaching that I do. I have labor coaching currently, and when this video is being aired, February and again in May. So make sure you join those if you are preparing for labor, okay? That was a really good one with the step. Now you're gonna move the step out of the way. I'm gonna get my ball. There's so much, let's sit on the ball first, okay? Because there's so much we can do with the ball. You're gonna sit on the ball first. Instead of bouncing, you're gonna do some circles. So you're just gonna get some circles in, get a good stretch, movement through your body. We'll do like 10 in each direction, okay? This is just getting your body ready, creating some movement. We want our pelvis to be able to move, and we want the muscles around to be able to allow that, because when your baby comes through your birth canal, the baby has to come through your hip flexors, your round ligament, your glutes, your pelvic floor. All of those muscles have to relax and get out of the way, switching directions. So if you have tightness in these areas, it's gonna make it a little bit harder for your baby to come through. So working on some like mobility and relaxation sounds wild when you're in the 3rd trimester. How can you relax right now? Totally get it. But that's what's gonna help have a smoother birth experience and a smoother labor. And maybe go into labor a little more naturally, especially if you're being pushed for an induction. If any of these things are happening, highly recommend you grab Pelvic Power so you can have a little more support. Okay, some circles. Now you can do it with or without a ball. I like to use the ball. Your knees are gonna be out and your feet are together, and you're just resting on the ball. Just nice and easy. You can just hang out. We're gonna just hang out for like 30 seconds or so. When you're in this position, your pelvic floor is able to relax and kind of lengthen a little bit here. Another position that can be really good to allow your pelvic floor to lengthen and relax is like a deep squat. So like, you know how babies get all the way down and like put their butt to the ground almost? That's what you can be doing. We're not gonna do it in this video, but that's another option to prepare for your pelvic floor for birth. Your pelvic floor does not push your baby out. So Kegels, stop doing the Kegels to prepare for birth. I'm just gonna say that right now. Your pelvic floor has to move out of the way to give birth, okay? While you're in this position, you're gonna kind of rock forward and backward, but when you rock back, keep your knees underneath your hips, but put your feet out further. So you're kind of rocking forward and backward. Just nice and gentle. When you use the ball, there should be room for your belly here, so you have more room. You can do this with or without a ball. So if you don't like the ball, or you don't have a ball, you can do it on your hands and knees. But just gently rocking. You can even do some like back and forth, side to side, some circles, and circle the other way. Just relax. You can even just find a flow of like what feels right for you and just follow that for this time. So just whatever pattern you want to do, whether it's forward and backward, side to side, circles. Just stretch and relax. Relaxation during the 3rd trimester, when you're probably the most stressed. Maybe you're ready to get this baby out. Maybe you're not ready for the baby to come because you're not ready. You still feel like you have a million things to do. No matter where you are, that's what you're going to try to do, is just get your body to move and relax. Nice and easy. Okay. Another one we're going to do are some gentle adductor rocks. I'm going to put this in this chair so it doesn't roll away from me. So your leg's going to be out to the side here. The further out, the more intense stretch. So try to keep it back towards you, but you're just gently rocking backward and forward. We're going to do 10 on each side. You might notice one side is a little tighter than the other. That is common. If any of these movements hurt, they don't feel good, they don't feel right, stop doing them. Listen to your body and do what feels best for you. What feels right for someone else may not feel right for you, and that's okay. And if you need more help on specific individualized guidance, send me a message on DM on Instagram. We can chat about it. One more time. Or if you're within the mama community, you know, you can message me through there and have some one-on-one support. Just nice and easy breathing, back and forth. If you are dealing with pain during pregnancy, your 3rd trimester, you're also preparing for labor and birth, and you do want that added support, the Mama Bundle has Secrets Releasing Pregnancy Pain, which is addressing your pregnancy pain, so you can have pregnancy with less pain. It gives you pelvic power, which is labor without the fear, and postpartum support. And then it gives you, there's weekly coaching sessions through Zoom that you can hop into, and you do have the one-on-one support. So I do answer my DMs on Instagram as much as I can, but when you're within the mama community, you almost have like a direct access to me, and I can get back to you a lot quicker, and I respond to those messages throughout the day, opposed to Instagram, which is just a couple times a day. If that, sometimes I don't, okay? This last move we're gonna do, if you're having pubic pain, skip it, stop this video, you're done. If you're not having pubic pain, you're gonna do this next movement here. It's gonna be windshield wipers. So legs are kind of at that 90-90, you're leaning back, and you're just gently rocking from one side to the other. You might feel a stretch through the top part of your leg, you might not. One leg might feel a little bit tighter than the other. We're gonna do 10 on each side, okay? So I think we're sitting at 3. If you watched any of my videos, you know I lose track of counting. I cannot talk and count. Shout out to all of those amazing people who work out with you and you follow their videos, because that's how I work out as well. But now I think I understand why, if anyone follows Kaylee Cohen, why everything is timed. She doesn't have to worry about counting, because I couldn't. Okay, one more on each side. And then something else I want you to do is, as your knee comes down, try to lift that leg up. Can you lift that leg? If you can't, physically lift it. And then we'll just do 5, like 5 on each side. Physically lift. Coming on back. So you're getting a little bit of that internal rotation. Okay? If you can do it on your own, that's even better. If you can't, then use your hand. Okay? I don't know. We're gonna do one more on each side here. This will be your last one here. Okay? There's a little quick labor prep that you can do. Sometimes if you do it before bed, you sleep better. If you're having a hard time sleeping because you're in pain, you're uncomfortable, send me a message. Most of the 99% of the time, the most thing I hear from moms is, I'm sleeping so much better. I don't have to pee as often, and that's what you deserve, to be able to enjoy your pregnancy, have a positive birth, and have a good postpartum experience with support so you don't feel so alone.